The Tamilnadu Dr. MGR Medical University is one of the premier medical universities of the country. It is the second largest health sciences university in India. Named after the former Chief Minister of Tamil Nadu, late Honorable Dr. MG Ramachandran, this university is celebrating 2012 as the Silver Jubilee year, having started in 1987. Various academic activities have been implemented as part of the Silver Jubilee celebrations. During the 22nd Convocation, the Honorable Chief Minister of Tamil Nadu laid the foundation stone for construction of the auditorium, guest house and 2 additional floors in the existing administrative building.
It is my privilege to deliver the Convocation address on the occasion of the 22nd Convocation of the Tamilnadu Dr. MGR Medical University. This is the 3rd time I am participating in the convocation of this august university. I am glad to learn that this university, which is named after our beloved Purachi Thalaivar Dr. MGR, has grown to become the 2nd largest medical university in India. It is also a matter of pride that this university has been responsible for regulation and maintenance of high standards of medical and allied health education in our state. Good health plays a pivotal role in the all-round development of society. Only a healthy population can contribute meaningfully to the overall economic growth of the country.
This premier health sciences university has set several milestones in health education and research. Last 3 years period has been a lifetime of transformation for this great institution. Efforts were taken to put in place a credible regulatory and institutional mechanism to develop standards in our medical system.
We have brought it contemporary and changed exam marking system, the pattern and the way the students are questioned. We wanted to increase the standard from the practical as well as the viva. So this is another more student-friendly attitude which we have brought.
For ease of governance, the university courses have been grouped under 4 fields: medicine, dentistry, Indian medicine and homeopathy and allied health sciences. The Tamilnadu Dr. MGR Medical University took the task upon itself to update the syllabus in all the areas.
We called all the teachers as well as experts from the various medical colleges, dental colleges, nursing colleges and had committees to look into the syllabus and update the syllabus, because the main aim was to bring it contemporary. What was knowledge-based education has now been changed to competency-based.
The evaluation methods have been modernized with student-friendly approach. Several of the successful methods followed here have been taken up for implementation at the national level.
The evaluation methodology in the exams was also 2 decades old. So the first time we sat and then discussed ways of changing the evaluation of a student. Also that has been changed. The exam pattern was also the same as it was for 20 years ago.
The administrative reforms, accounts restructuring and IT developments have helped a lot in the progress of this great institution.
As far as the IT was concerned, there are only about 20 computers in the whole university and people are using it very occasionally. I said the days have come when everything is computerized, So we bought a computer for all the staff working at all levels, 300 computers, gave it to everyone, and made sure that all the programs were computerized.
Online transfer of question papers. Like on the day of the examination morning, question paper will be uploaded and it is in the encrypted form, that is in the machine language that nobody can open, and they will receive a password just before the start of the examination. Only then they can open the question paper, take a printout and then give it to the students.
In finance also we have introduced the accounting system, wherein the double entry system, I think it is called Tally, wherein we can bring in all the accounts through the computerized. So in a brief nutshell, we can find out the financial health of the university, the expenses which have been incurred and the inputs which have come in and the dues which have to be collected from the various colleges. All these were once again computerized and made very friendly with the
right from the undergraduate level, importance is given for forming small groups for training. Facilitator or a guru helps the students in problem solving, case scenarios, decision making, etc.
In medicine is the only profession where you need to get the blessings as well as guidance from Mata, Pita, Guru and Devam. This we used to stress to all our students.
All scientific outcomes are based on research. A research council has been created for promoting research in clinical and basic sciences by providing needed research grants.
Research is another area which is highly talked about but always neglected. Doctors basically are very busy treating patients and taking care of their practice, but they were not applied the mind to do research. They always used to shun away from the word research. Now, I was the one who made research as friendly. For example, a doctor treating patients, if he has treated 100 patients in one method and found out something new, then this is what we call research, which is clinical research. Now, everyone is thinking of basic science research. So, I told the clinicians that clinical research is different, and if you have found a method of operating or you have found a method of diagnosing a particular problem, that should be brought to the forefront, and we made research friendly. So we have introduced changes at the undergraduate as well as postgraduate level to make research more popular amongst the medical fraternity, which was not till date.
In the recent days, the medical field is getting tremendous changes throughout the world. Recognizing the need for global tie-ups, this premier institution has taken several initiatives.
A global approach for us to reach international standards, we need to have tie-ups with universities who are doing the latest as far as medicine and surgery are concerned. And so it has been an endeavor from our side to have tie-ups with the universities so that we can have a faculty exchange program wherein faculty from our university can visit for a short time, up to 2 to 3 months, to observe what is going on latest in their clinical areas, in their research areas, and come back and do it in our country. The idea should be that they should be the guides for the younger generation, so that the latest which is happening anywhere in the world should happen here.
When it comes to clinical research, the Vice-chancellor himself leads from the front, being the pioneer in orthopedic oncology in the country. He has carried out 1,700 surgeries of custom mega prosthesis. This is the highest number by a single surgeon in the whole world.
I am basically an orthopedic surgeon, and I have spent 36 years of my life at Government General Hospital and Madras Medical College. And for 2 decades I have spent as a visiting consultant at the Regional Cancer Institute, Adayar, doing work on bone cancer. My subspecialty is orthopedic oncology, which is dealing with bone cancer. When I started my work, people with the cancer of the bone in the leg or arm used to lose their limb. Then when my training abroad, I found that they have already ventured into saving their limb rather than amputating. Hence I decided that this technology, which was still not available in our country, has to be introduced in our country, and it must spread to a vast country like India. So when I was called by our former advisor, Dr. Krishnamurthy and Dr. Shanta, to lead the Orthopedic Oncology unit at the Cancer Institute, I very happily took over and we started doing research on bone cancer. The methodology of removing a cancerous bone and replacing it with a metal joint was what I started in Cancer Institute at 1988, thereby avoiding amputation in these cancer patients. And this treatment of limb salvage surgery in bone cancer became very popular, and it has spread all over India now. And at present, about 15 states are doing the operation now due to my persistent efforts in oncology.
The present Vice-chancellor took initiative in starting the bone bank at the Government General Hospital in 2005. Besides cancer cases, the bone bank helps in trauma, spine and deformity corrections.
In the year 2005, 2 new tower blocks were inaugurated by the then Chief Minister of Tamil Nadu. At that time, I was doing the work on bone tumors, and we had the opportunity of opening a bone bank, wherein, because after a person is dead, people who are wanting the kidney or who are wanting the heart will lose interest in the cadaver. Now, the bone is the only organ which can be retrieved for up to 24 hours from a cadaver, and then if it has to be processed and stored. We created a facility in Government General Hospital wherein the bone from a cadaver can be restored, retrieved and stored, and then used in the same place as for a bone cancer. For example, in a bone cancer, we remove the cancerous bone and the large defect is filled by a metal joint. Now, in these cases, bone from the bone bank can be used to fill the large resection defects. So, it had once again the same usage of filling the gap after resection, and can be used in tumors as well as trauma, wherein a segmental loss is due to a car running over the leg and a segment of bone is lost. So it was started in 2005 and it is continuing to serve its purpose at the Government General Hospital.
Role models play an important role in inspiring students to learn, overcome obstacles and understand the positive values. Hence, the leadership of Tamilnadu Dr. MGR Medical University has given importance to bring great role models to inspire the budding doctors.
In order to stimulate the medical and nursing professional, we have had great personalities visiting our university, particularly the Convocation as well as the university buildings. For example, our former President of India, Dr. Abdul Kalam, was invited to the Convocation on one occasion, and his thought-provoking speeches stimulated all our younger generation to emulate certain qualities from him. You need not be in close association with someone. You can always look upon someone from a distance as a teacher and take upon the qualities which he has imbibed and work hard. And this is what I have been trying to stress upon the younger generations affiliated to the university.
Medical profession is respected as the noblest profession in the whole world. At the same time, being a doctor is having the responsibilities more than the privilege.
I always keep telling that the younger students as well as the medical students or nursing students, whoever have chosen health as a part of their life, we have nothing to offer them but blood, sweat and tears. You know, it is only hard work and hard work, and that only will take you up the ladder. And once a doctor, you are a doctor 24 hours. You see, there is no time you can say, I am on a holiday, so I will not do my profession when your neighbor is suddenly having an emergency. So this is another hazard of taking up this as a profession. And I wish all the younger generation the very best in life.
Doctor is a word, when heard by anyone, can immediately develop respect in the heart. Tamilnadu Dr. MGR Medical University is taking every step to nurture the future doctors who are knowledgeable to the global standards and at the same time respecting the value of life.